my name is Vanessa Baker. I am a nurse practitioner student here with Youngstown State University. Can I get your name and date of birth to start off?
Zoe Ziegler, 7/25 of 2000.
Okay. And now what brought you in today, Zoe?
Lately, I've been having a sore throat, runny nose, fatigue over the past week.
Okay. So now would you say these symptoms, did they come on pretty quickly or kind of a gradual onset?
Oh, gradually.
Okay. Would you say any fever or chills?
No fever or chills, but I have had a cough and sort of a wheezing.
Okay. Now with this cough, would you say is it a dry or a moist cough?
Dry.
Okay. And then now have you noted any nasal drainage?
Yeah, there has been like a yellow and greenish drainage coming.
Okay. Have you tried any over-the-counter medications to help relieve any of these symptoms?
I did try Mucinex, but it didn't really help all that much.
Okay. So now, any other medications that you take on a normal basis that are prescribed?
Yes, I take birth control daily.
Okay. So then now moving on to any medical history, do you have any known drug allergies?
No drug allergies, just regular seasonal allergies.
Okay. And then just real quick, family history. Does your mom have any history of any medical diagnosis?
Yes, she has asthma.
Okay. And then what about your father?
High blood pressure.
Okay. All right. So then just real quick also social history for you. So you are a college student?
Yes.
Okay. Do you partake in any alcohol usage?
Socially on the weekends, I might have one or two.
Okay. What about tobacco, nicotine, vaping?
No.
No. And then now, do you exercise?
Yeah, regularly. I'd say about 5 times a week.
Okay, good. All right. So moving on, going to start with just your assessment. Do kind of like a ears, eyes, nose, throat type. So starting off, I'm going to take a look at your ears. Now, would you complain of? Do you have any complaints with your ears? Any issues?
Yeah, this past week they have been feeling pretty clogged.
Pretty clogged. Okay. So then now looking externally, I can note no redness, no drainage I see. Now when I palpate, is there any tenderness?
No.
Okay, and then now palpate on this side. No tenderness?
No.
Okay. So then I'm just gonna take a look inside. So first pulling back and up. Okay. Alright, so I can see on this left ear that your auditory canal is clear of any foreign bodies. There is no drainage. I do note that your tympanic membrane is slightly red and bulging.
Mm-hmm.
So now I'm going to take a look at this ear, pulling back and up. Okay. Okay. Also noting the same thing, your auditory canal, there is no foreign bodies, no drainage. That tympanic membrane also looking slightly red and bulging.
Okay.
So moving on, I am going to look at your eyes. So go ahead and remove your glasses for this real quick. So just looking at your eyelids, I see no drainage, no crusting, no ptosis. I'm going to pull your eyelids down and have you look up. Okay, noting that your sclera is white, your conjunctiva, there is no redness, no drainage noted as well. Now real quick, I'm just going to assess your pupils. So I'm just going to have you look straight ahead, and I'm just going to make sure that they are round and reactive to light. So both pupils are round, they react to the light, probably about like a 3 millimeter in size. Now I'm just going to check and make sure that you have no nystagmus, so I'm just going to do the 6 cardinal fields of gaze.
Okay.
I'm going to have you follow the tip of my pen,
Mm-hmm.
and I'm just going to move it throughout, making sure I see no nystagmus, which I do not. Okay, so eyes look good, pupils are good as well. So now moving on, I am going to just look at your mouth and your throat. So go ahead and just open up and say ah. Okay. I note that your mucous membranes, they are pink, they are moist, along with your tongue is pink and moist. Uvula is midline, and it did raise as appropriately. And then now, do you have your tonsils?
No, I do not.
Okay. So I noted in the back, no swelling of your throat. It is pink as well, and then no discoloration. So now I'm just going to assess your lymph nodes, feeling for any bulging, tenderness. So starting with the pre-auricular, and then doing the post, and then now going along to the submandibular and the submental, and then going down to the anterior clavicle and the posterior, and then the occipital is in the back. Okay, and then doing the supraclavicular. Okay, so no tenderness was felt throughout?
No.
Okay, so your lymph nodes, nothing, no bulging, no masses were noted, so that is good. So now, real quick, I'm just going to assess your nose, seeing that from external, I see no redness, it is symmetrical. Just real quick, do the patency, so I'm gonna have you close one nostril and breathe. Okay, and then close the other one and breathe. Okay, so noting that that one nostril is a little bit occluded. So now I'm just going to look at your, okay, seeing that your nasal membranes a little bit red with that nasal drainage present, but no deviated septum. So I am going to feel for your sinuses, feeling your frontal sinuses. So no tenderness, no masses, and then your maxillary sinuses, no bulges, no tenderness was felt.
Nope.
Okay. So now while your glasses are off, I'm just gonna palpate your your lateral gland. All right, feeling no bulging and then no tenderness there.
No.
Okay. You can put your glasses back on. I am now just going to do listen to your lungs and heart. So looking off the bat, I can see that your respiratory rhythm is normal. You do not appear to be in any distress. You're not using any accessory muscles. I am going to take a listen to your lungs, listening anteriorly, and then just go ahead and take a breath in and breath out. That's every time I move my stethoscope. Okay, listening to the bass. Okay, so now I'm going to listen posteriorly to your lungs. Move in your hair. Go ahead and take deep breaths. Okay, good. All right, so now I am going to listen to your heart sounds. So starting off, I'm going to listen to the aortic. You can breathe normally. And then go on to pulmonic. And then Erb's point. And tricuspid. And then under here to mitral. Okay. Noting no murmurs to your heart sounds. And then lastly, I just want to make sure that your trachea is midline, palpating, okay, that it is midline. All right, so that concludes the assessment. So just kind of going over everything abnormal that was found, just your tympanic membranes a little bit red and bulging, which you did say they did feel full. And then nasal wise, so I did note some redness there with your mucosa and did see, and then you have also been saying you've been having some yellow greenish drainage. And then lung sound wise, I did hear a little bit of wheezing on exhale, which you have said felt like you've been wheezing. So those were the only things abnormally. So basically I would kind of say you're kind of showing symptoms of the common cold, especially with how you've saying your symptoms have kind of come on gradually, and then you've had no complaints of a fever. Everything kind of seems fine otherwise. I I would recommend for your cough, kind of take a cough suppressant. You can try Tussin, that's over the counter. And then for your nasal congestion, I would say maybe try a nasal decongestant like Afrin. The only thing with Afrin is I would not take it more than 3 to 5 days longer, because then that can cause rebound congestion.
Okay.
So we don't want that. Other than that, I would just say keep up on your fluids, stay hydrated. Test wise, we could send out a nasal swab just to be sure that you don't have a virus or anything else that is going on that we may have missed.
Okay.
Then follow-up wise, I would say you're good unless your symptoms present longer than like 3 to 5 days, or if you do start to feel like you have a fever and chills, or your symptoms worsen, I would say maybe come in then and we'll evaluate you. So
okay.
Other than that, do you have any questions?
No, nothing else.
Okay. All right. Well, thank you for your time, and we'll get you out of here.
Thank you.